Ahora, la charla SSI Mantra 3, un nuevo cambio de paradigma en la cirugía, presentada por Rohan Kumar, ingeniero de producto en SS Innovations, una muestra del avance tecnológico que está redefiniendo la precisión y el alcance de la cirugía moderna.
Hello everyone. So I'm Rohan and I'm from the company SS Innovations. Uh, so we have a flagship surgical model which is SSI Mantra, and here we have multiple departments which is SSI Mantra, Mudra and Maya. Mantra is our flagship product for medical surgery, and Mudra is the instrument part that handles precision surgeries and everything. And Maya is a department that works in the mixed reality fields where we create applications for VR headsets and everything. And that syncs with our Mantra system and other applications as well. So this is an overview of the whole Mantra system in itself. We have So we have surgeon command center over here. We have vision cart and patient side arm carts on all the sides. So the Mantra system actually supports 5 arm systems, that is 1 camera and 4 arms. And the vision card is the control center where all the data and everything is connected, and AD connections is throughout the system. The surgeon command center, where the surgeon will be sitting and performing the surgery at just one corner of the system, where in the OT, sorry, where he don't have to just lean or do anything. He just have to sit comfortably, perform the surgery, and it will be very useful. So we have a 3D monitor and a head tracking camera that just gives access to the surgeon who is performing. The OT staffs present in the OT can also have the 3D vision with this vision card. So this also provides 3D monitors and everything, but the controls and everything will be provided to the surgeon command center handler, that is the surgeon. This is the patient side arm card, which is so the Mantra 3 means we had a previous version which was a little bit bulkier and it was let's say a little bit unstable, and this one is far more stable and far more superior to the previous model, and it's sleeky and outperforming in every way. Why we have a single arm cart model is because, let's say if you want to perform a surgery where the patient's port placement needs to be reached to a specific position, and if you have a single boom system where you cannot reach there, you can move the arm carts to a particular position where you can just align them and perform the surgery. That will be easy for the surgeon as well and the patient as well, so that there is only minimal invasive surgery. As mentioned earlier, this is the vision card, and this has the UPS backups and everything, and the recordings and playbacks, streamings and everything are done here. Why we do that is for training the models to implement AI in the surgery itself, and that will be explained later. So this is SSI Mudra, and we have multi-speciality instruments for all the type of surgeries. And our CEO is actually from a cardiac background, and he's focused on cardiac surgeries. So we have our own specialty for cardiac surgeries as well. So SSI Maya, the department that I am from, we develop software applications as mentioned earlier. And here we have 3 applications, which is one is SSI Guru. This is for teleproctoring. So what teleproctoring is, let's say there is a senior surgeon remotely available anywhere around the world, and they want to connect with the surgeon who is performing surgery in the hospital with the Mantra system. So the surgeon, the proctor actually, can connect with the surgeon who's in the hospital, get the same endoscopic video, and guide the surgeon during the surgery. And all these panels that you're looking at in the video are provided inside the headset to the proctor, and The proctor, on special cases where the surgeon is not able to proceed with the surgery or is afraid to take a step or something, the proctor can take over the surgery from there. And but for that, they will be requiring a special surgeon command center, which will be specifically for this case alone. And we have the AR glasses. So we have a telesurgery model also, where the surgeon command center can be placed in anywhere that you want, not just in the hospital in itself. So you can have this surgeon command center at your home or any particular place, and you can perform the surgery. And the practical case for that is, let's say we want to support a military case, and there needs to be a surgery that needs to be done. Military surgeons are available to the people, but if there is a special case that and minimally invasive surgeries needs to be done very quickly, so then the practical scenario for telesurgery comes here. Also, let's say we want, okay, just proceed with this one. So yes, first application is from the Maya is for intraoperative anatomy identification. The purpose is to identify segment organs, vessels, tumors, margins, and other anatomies of interest for preoperative guidance and navigation using AI and XR. So during a surgery, you get the endoscopic video, and in the feed in itself, you will be identifying the tissues, the organs, and the instruments that is used. And during the surgery, you can get all the patient's data, and according to that, you can, if the surgeon is new or if the surgeon is even experienced also, they will be getting a proper support through AI in itself. So how this model that we were actually approaching was, we use video acquisition using NVIDIA. We uploaded the data that we collected from our surgery in itself, and used that to train our models and proceed with the AI interface and rendering overlays. And using this, there are multiple other scenarios where you can have the patient's DICOM images and turn them into 3D reconstructed model and use them in preoperative purpose. So this one is what I was talking about. So over here, we have the patient's body, patient anatomy, where inside the endoscope you will be getting the feed and everything, but along with that, a 3D model that is rendered through the patient's DICOM images is superimposed on the patient during the surgery, so you will have an idea how to even proceed with that. So let's say we are performing a radical nephrectomy, then we have partial radical nephrectomy as well. So proceed, there is just slight difference between the surgery, so you will understand how to proceed with that. So the vessels and everything will be very clear during the surgery in itself, so you will have an idea what was present before cutting over the place. So this is third application, patient-specific virtual surgery. So from the radiology department, we collect the MRIs and CTs and other files, and those are converted into 3D reconstructed models. And we have a simulator that in which you can perform the surgery before the actual surgery itself. So you can just pre-plan the surgery, have an idea about how to proceed with the surgery. You can do the port placement, you can do the card placement, you can record those, and then preoperatively superimpose during the actual surgery in itself, so that you don't have to make any mistakes, or you can improve your surgery and the efficiency will be improved. Yes. So this is SSI Chitrasa, one application from Maya, which is a DICOM imaging software. So from here, the DICOM images are collected. These are used to produce a 3D reconstructed model that I was mentioning before. And these models are imported in the VR headsets, and these can be practically used as a preoperative planning. I will show you this just a second. Can you switch? So this is a virtual simulation room that was created, and the software that you saw in the previous video produced a 3D anatomy model like this that I can inspect before the surgery in itself. So I have this model right in front of me that I can inspect by holding this or enlarging it as big as I want. And I have this cube, which is a simple tool currently that is used for demonstration purpose only. So let's say I pick the cube, I shrink the size of the cube, and I slowly superimpose on the kidney. So I can see the vessels over here. And if I want to have a clear look, I can just bring it much closer to me, bring the cube, and enlarge the cube or the patient's anatomy itself. Similarly, I can use this cube on any place to identify any anomalies or anomalies like this. So we have over there a patient Mayo table also and a patient lying over here. And this particular OT room can be used for preoperative planning that mentioned before. So we can do port placement, and this specific room is created for actually a right radical nephrectomy. So you have a model of a whole mantra system in itself over there that shows how to place the patient side arm cards according to this. And you have all other patient surgeries that you can pre-plan or practice. We have a default model, and we have a patient-specific model that is created from the application that was shown before. So you can pick the cannulas and do the port placements as well. So you can just walk to the place actually, but I haven't set the floor. This is application issue, so I haven't set the floor. But you can actually walk to the patient and place this anatomy model in the patient and do the port placement as well, and save the file and superimpose in the OT in itself, so that before the surgery, let's say it takes around 1 hour to do all the setups and everything. It might take much lesser time because you have pre-planned everything a day before by getting the actual patient details and everything. Can you switch? So yes, that was one practical case. Also, the same application, you can segment the models like this and perform a proper diagnosis. So you can, let's say some other surgeon also has a headset like this. So we can create one room where the other surgeon also can connect with you in the same OT and do a diagnosis or do a study itself. The surgeon necessarily need not to be in the same place. He can be on some other country or some other continent itself. So this is SSI Guru, the teleproctoring application that was mentioned. So this is Dr. Sudhi Srivastava. He is actually performing a cardiac procedure that is happening 600 miles away. And this is the OT where the surgery is being happened, the bottom one. And over there also we have one proctor just for testing purpose who is actually viewing everything that is happening inside the OT in the particular screens. So as you can see, the proctor can actually grab the panels of the screen and move it anywhere he wants. That is for the flexibility of the surgeon. We have a data registry system where all these details are collected and stored, not just for data collection purpose alone, but for future planning and training the models itself. So why this is required is creating our own ecosystem will have a solid base, and training our own models from the data that we collect from our own surgery will have a better impact instead of getting open source applications. So yeah, for telesurgery, uh, the limitation, let's say for rural areas, there is no surgery that can be performed. So we have our own bus, which is Mantram, and just a second, which is Mantram. So we can travel the robotic system to any rural places and take the robotic system over there and perform the surgery by surgeons anywhere around the world through the telesurgery process. And this is the telesurgery model. So we have the headset over here, and previously I showed you that there was a monitor in front of you. So there were two monitors, one 3D and one 2D monitor that was for controls. So instead of having those monitors, you can have headset like this and perform the surgery and have multiple screens inside in itself. And let's say this is a little bit bulkier. So we are developing normal glasses, AR glasses, that can be wear for like 8 to 10 hours without any pain. So you can replace that, just have one small panel for the controls and have surgeon command center in a minimal design. We have our own center of robotic system surgery where we train the surgeons here who are new to robotic surgery or want to learn about or want to train other surgeons as well. So the future developments from SSI are we have pediatric robotic surgery. So currently the instruments are a little bit bulkier if you compare to children whenever we are using on children's. So these instruments will be much smaller and minimally invasive surgery is already in the part. So we have single arm robot applications where we have endoscope handling, telerobotic ultrasound and biopsy, and targeted therapies also. Yes, that's all. Thank you.